Hello, I'm Joe Ruggiero, and welcome to my podcast, Inspired, and the people who inspire me. You're in for a treat this morning because I've got my cardiologist here, Dr. Vasim Lala. And he and his brother run a very successful cardiology program. And I want you to hear from him because he knows what's best.
Thank you so much, Joe, for having me here. I'm from India,
Right.
Originally. I think we moved here a long time ago. I was 13 years old when I moved.
Wow.
And I grew up since then, Michigan. So Michigan will always be my home. Michigander? There you go, Michigan, right? So I went to Wayne State University for undergrad. I went to Michigan State University for medical school. I trained and then med school there. I did my residency and fellowship at Michigan State University. Then I went to Mount Sinai, New York to do interventional cardiology and endovascular surgery fellowship. So we were in New York City for about a year and a half. Okay.
And then your brother got
My
you
brother, he's been practicing here now close to 10 years with our other partner, wonderful partner, Mehran Khorsandi. He's been here for next 30 years or something. He looks more fit now than what he looked when he was 40 years old.
Wow.
And I joined them about 4 years ago. So between the three of us, now we've been in practice for a while, and I think we're growing. You know, we cover also Northridge Hospital now. So we cover Cedars-Sinai, Maine in the Beverly Hills, Tarzana Medical Center here, and then Northridge in the Valley. So those three. We don't have bandwidth to cover others yet.
We are hoping for Westlake.
Westlake, yeah.
Yes.
West Hill?
Thousand Oaks.
You mean?
No, Westlake.
Westlake. Is there a hospital there?
Los Robles.
Oh, Los Robles, yes, yeah.
Yes.
Los Robles, yeah, you guys have wonderful cardiologists there as well. Some of them I know, they're good friends. But we wish, if you want to come see us, you know, Tarzana Hospital is not far. Tarzana location is not far.
Right.
You know, you've been a wonderful patient of ours.
Well, I respect you, and I love the way you believe in preventative medicine. Yeah. And just let's talk about that. Let's talk about oblations. Let's talk about the patients that you have waiting in the waiting room, that you wish that they would have come to see you earlier, but trying to get people off their butts and coming in to see you.
No, I think the biggest thing is in medicine, especially in the cardiac and vascular, right? We do a lot of cardiac stuff and vascular stuff. That includes heart stents, okay, that includes vein problems, varicose veins, arterial disease in the legs. And unfortunately, a lot of patients, when they come to us, they come in when things are bad.
Right.
Right? Obviously, most people, when they're doing well, things are fine. When they're, we call so-called asymptomatic, meaning they're doing okay, they don't want to check up on a lot of the stuff, right? The best thing to do is to follow up with your doctors regularly, whether it's your primary care doctors or it's your specialist, okay? We don't want to treat things when things are looking bad with your eyes. A lot of people come in when their leg looks like, okay, well, that doesn't look good. Right. It looks darker, or this looks skin or swollen. That's when people come in. And yes, a lot of times that's how you diagnose and things. Many of these things can be preventable.
Right.
As long as you had followed up with somebody, right? And many patients, I think many patients are very good at it. We get a lot of consults where they come in and say, you know what, I just want to check in. This is my age, my grandfather had this, my dad had this, just want to make sure everything's okay. Just because you're walking around playing golf every day, life is good, does not mean bad things can't happen.
That's right.
Right? Especially if you have family history. All right? The best thing to look into your family. People are like, oh, what do you think? What are my risks of me having something? Just look into your family.
Right.
Mom, dad, brother, sister, grandmother, grandfather. Look at what kind of problems they have. If you don't take care of yourself, probably that's where you're leading.
Well, the interesting thing with myself is I've always exercised since I was a kid. And I was in the gym, and I felt, I went to my primary, and he said, I want you to go to the Lala brothers. And I went, and you gave me a battery of tests, and they picked it up in this nuclear stress test. and you said you got 90% blockage in one of the chambers. You need a stent. And you went ahead, you performed this operation, and you said, it could last for 30 years from now. I don't know if I want to live to 110, but I'm ready.
Let me tell you, age is just numbers, right?
Yeah.
And there's something in California water. It's not like that in Michigan. I mean, people here, 90, 95, 100, they look gorgeous. They're very active. The only thing we look at is the functional independence of a patient, right? A lot of people are like, oh, well, this patient is this much age. This patient is that much age. Should we really do this? All you got to look into is what is their quality of life. Functionally independent person, doesn't matter what age, right? Enjoying their life, I think they should deserve the same treatment like any other patients do, right? And you had something going on, right? But you were a pretty active person. So a lot of time when you're active, you don't think about it,
Right.
right? Until
Bam.
further battery of tests happens and you find something, right? Yes, there are a lot of patients who have abnormal finding and they have zero symptoms.
And what is a stent?
Stent.
Yes.
Stent is it's made up of cobalt chromium. It's a metal, okay, and it has drugs around it, okay. So when we put the stent inside the artery, whether it is your heart or your leg arteries, okay, the drug slowly inhibits any further growth of the plaque. That's the goal. And now we do it. When we do it, and most of us now, doctors, when they do it, we use ultrasound inside your tiny arteries to make sure everything looks pristine. That's why the stents nowadays last a lot longer than they used to last before. So I'm hoping that your stent never gets blocked.
Right.
Yeah.
But you only offered a local. I heard you talking. I didn't feel anything. And you were trying to get it into my wrist, and then you decided to go through the groin, which I think was smart. But I didn't feel anything. And
That's because we give anti-feeling medications.
yeah,
Yeah, we give medications. It's called moderate sedations. Basically, most patients are relaxed.
yes.
Okay.
Absolutely.
And sometimes we have to use general anesthesia, but that's rare.
Yeah. And what other situations that people should pay attention to in terms of a normal nutrition? I know that you believe in fasting.
Yeah. So this is my opinion and my professional opinion about nutrition, right? I think people get so confused about diet and food and what they want to eat, what should they eat, what should they avoid, right? It's hard to honestly focus on that rather than keep your life very simple. Every culture have their own kinds of foods, right? American diet, Indian diet, Italian diet, every person who are born, right? There's certain diet you grew up with, and this is what you eat. So it's very difficult for me to tell Joe, hey, I need you to stop eating whatever you're eating, start eating this and this and that. And you're like, what are you talking about? This is all I eat all my life. So your lifestyle becomes, most humans, most people, they eat same food majority of the time. If you look at your schedule in 1 month, if you look at the diet or the food you eat, 70, 80% of the time it's the same things, right? So in those food, how can I eat healthy as possible, okay? So the biggest thing we need is what? 3 big things we need in our diet: protein, fat, carbohydrates. All 3 of them, you can get it from nature. All 3 of them, right? You get proteins from plants, you can get protein from meat, right? Humans are allowed to eat both of them, right? That's why we got these canine teeth, right? We're not supposed to be vegetarian or only meat eaters, right? We eat both of them. So you get your proteins, you get your fats from the meat, and you get most of your carbohydrates you can get in from vegetables, right? Most vegetable, legumes. When people think about legumes, like beans, everybody automatically thinks this, oh man, this is all protein, right? What do you guys think when you think about beans and stuff like that. We think that these are high protein. They are high in protein, but they're also high in carbohydrates.
Well, then why do you fast?
Fasting, I'll come to that. So these are the main food you should focus on, right? Carbohydrates, getting from these things instead of eating bread and pasta and these kind of things, or reduces. Now, fasting. Why do I think fasting is better for you, right? I don't believe humans are supposed to eat 3 times a day, right? You don't need to. Look at what did human civilization did 10,000 years ago. 10,000 is when the agriculture was invented, right? What did humans eat? Humans were hunter and gatherer, right? They ate meat from the animals, right? Proteins, carbohydrates, fruits and vegetables. That's all they did. They didn't make pasta. There was no bread available. Nothing. Those things came after when the agriculture was invented, right? And they only ate when they hunted and they had food. So there were periods of time they probably did not have food, just like any other animals, right?
Do they drink
Lions or
water?
anybody, right? You drink water, you hunt, you eat. You don't hunt, you don't eat. So there was a periods of fasting. They didn't just keep eating because food just wasn't readily available. You actually had to work for your food to get it. So those people, most of them were in a tip-top shape. Right? Now what's happening, we have too much food available, too much junk food available. It's all processed.
Yeah.
It's all saturated. Too much available. So we eat too much. Right? So a lot of my patients, I've told you, right? I tell them, hey, learn to skip a meal. I always ask them first, how many times do you eat? And most of them like, okay, 2 times, 3 times. Some of them will say, okay, once or twice. But then I ask them, what do you eat in those times? And many of them will say, oh, I don't really eat a lot, doc. Well, sure. Why don't you take a picture next time what you eat?
That's a
And
good
you'll see.
idea.
You'll see, right?
Yeah.
You'll immediately know. It's like, yeah, I eat 1 time a day, but I eat a lot 1 time a day.
Yeah.
It is all about, the best thing to do is skip a meal, probably eat 2 times a day, focus primarily on protein, meat, legumes. Try to get most of your carbohydrates from vegetables and legumes. You can have, now we live in a different world, right? We eat bread, we eat roti, we eat naan, we eat pasta. These are all carbohydrates, right?
What is the healthiest food? Indian, Italian, English?
Like, I don't
Chinese?
think... No, I would not comment on one culture to say they have the healthiest food. I think every culture has food which looks at this combination of protein, fat, and carbohydrates. It's that certain culture, they focus too much on carbohydrate. That's why, like American diet. What is American diet constitutes of, right?
Fast food.
Potato, fast food, fries, hot dogs, burgers, pasta, pizza. If you look at all of them, it's all carbohydrates.
Yeah.
Way high intake. In between, and not many of them are not filling. So in between, you snack on chips, soda. If you look at the prevalence of diabetes before probably 1960s and 1970 compared to now, it's very different. Why is that? Prevalence, that's when McDonald's started opening, right? 1970s, around that, whatever, I don't know the exact time when it opened. But when the fast food industry
Right.
started happening, prevalence of diabetes, sugar, sodas. Think about it. Coca-Cola,
Poison.
anything. It's poison. It is poison.
Yeah.
50 grams of sugar. If you look at what 50 grams of sugar looks like in front of you, you will never drink that.
Right.
You're like, oh my God, this is how much sugar is it in here that I just drank? This is all because of all prevalence, right? And then nobody knew what they were doing, so they blamed it on fat. Around 1990s, they were like, oh my God, it's big. You know why everybody's getting fat and having diabetes? It's because we eat too much fatty food.
Right.
So around in that era of 1990s, low-fat diet came out. Everything is low-fat. Don't drink whole milk. Don't eat anything with a full fat. Now the pendulum is swinging again. And now we're realizing, okay, it's actually not. Those are good fats.
Now, do you deal with diabetes? Well, only in terms of amputation, right?
So we deal with the whole spectrum. because we are cardiologists and we also do vascular, which is endovascular. That includes arteries in the legs, arteries in the neck, arteries in the bellies, anything that comes from the heart pump, all the plumbing that comes out of it. We deal with most of them. So we treat most of them. Okay, we do change heart valves, we fix holes in the heart, we fix the structure of the heart, electrical system of the heart, and a plumbing system of the heart, and everything that comes out of the body. And then any disease that affects those things. Right? That includes high blood pressure, affects your plumbing in your heart. Diabetes affects your plumbing in the heart. Right? Smoking, thyroid disease. Right? So any of the disease that affects it.
Well, the thyroid, doesn't that have control of the body?
Well, thyroid produces a very important hormone, okay, that maintains your metabolic rate of your body, okay? Thyroid hormones, right? It basically, that's endocrine department, right? Thyroid and the brains are connected with the bloodstream. They keep sending signals to each other to see how the body's metabolic systems are doing, okay? A lot of people, they have a thyroid problems where the body's either producing too much or not producing too much, right? Usually is not producing too much. That's why they take thyroid medications. It's called hypothyroidism. Okay?
How do you keep all of this knowledge current? Do you teach as well? Do you lecture?
Yes. So I give lectures to the Northridge Hospital, family medicine and residency programs.
Right.
And at Cedars-Sinai cardiology departments, where when we do cases, we have a lot of doctors in training. They will do cases with us.
Right.
Right? Because they're learning and they're going to be, you got to pass the torch, right? So you have to be on top of it. Plus, we are required by state of California, the government, and our medical boards every 2 years to have 50 credits of continuous medical education.
Wow.
Right? So, and then what the thing is, most doctors, this is what we do. We're very good at taking exams and reading books. So, and nowadays, a lot of the information we get is from social media, like Twitter, right? Instagram.
Absolutely.
A lot of doctors, a lot of people, this is where they post stuff, right? New cases, new drugs, new mechanisms, and we're constantly reading. So you kind of keep updated. And then, obviously, and I enjoy reading, so, and nerd, most of us are nerds, so we read about these things.
Well, do you do transplants as well?
Heart transplant, no. Okay, that is a completely separate department.
Right.
That includes transplant cardiologists who specialize in transplant physiology, and then you have a transplant heart surgeons, open heart surgery. We do minimal invasive procedure, minimal invasive surgery.
Right.
We do not cut open heart surgery. That is a cardiothoracic surgery, separate department.
Now, what do you call your firm again?
It's called Center of Advanced Cardiac and Vascular Intervention.
But you guys, you believe in preventative.
Definitely. We do prevention. Everything starts from prevention.
Right.
If you're a heart doctor or a cardiologist or any vascular doctor, prevention is the first step for everything. Unfortunately, a lot of the patients that get to us, that's no prevention here.
Right.
Okay, this is all treatment. Right? Because by the time they get to us, we are so highly specialized that by the time they make it to us, they're there for something else that's already going on. Okay? So a lot of the prevention is the family medicine doctors and internist doctors and cardiologists. Okay? Some doctors are very aggressive at sending patients early on to the cardiac and vascular people. And some doctors are not. And there's nothing wrong with it. It's all as long as prevention is the center of the care.
I said to my primary, well, don't send me to the cardiologist because they're very big on tests. And he said, those tests are very, very important to your body, that the heart is the organ that they have had the most advancement on.
Absolutely. And heart is the organ where, if missed, the alternative is.
Absolutely.
How often you hear about your colleagues or friends or family members where they're doing completely fine. It's like everything was okay. I just talked to them yesterday. I just played tennis with them yesterday, 2 hours. We had a lunch, and the next thing I know, I hear that he had a heart attack and died. Or he never woke up, or he or she, they had a dinner and they were watching TV, and all of a sudden they had a heart attack. So these things, having heart attack, it is a very different thing. You don't have to have a 90% blockage to have a heart attack.
Right.
You can have 20, 30, 40% blockage in your heart artery and can have a heart attack. That is a whole different talk on how the plaque is built up in the body and how it can rupture like a volcano ruptures.
Wow.
And when it ruptures, it's like the way I sometimes I explain to the patient is like, imagine your plaque is like a sitting volcano. It's fine. It looks beautiful, no issues at all, right? For 50 years, this volcano, nothing happened, and all of a sudden, it ruptures and the whole town is gone.
Right.
Like Pompeii.
Now, how do you
Right.
clean that out?
So that one is that's why now we have newer and newer technologies in the heart. The advancement in the heart and in the cancer world, certain field is, there are a lot of people who donate and they do all these things. CT scan of the heart arteries, right? It's very prevalent now than 10 years ago. People getting calcium scores, people getting coronary CT angiographies, because that will tell you now whether you have any plaque buildup or not.
Now, do you inject some kind of dye when you do a CT?
Yes, there is a dye that's involved to do a CT scan, okay? And it fills in your heart artery, and a CT scan takes a picture. And then it will tell you whether you have a 20% blockage, 40% blockage, no blockage, very tight blockage. You will know now. And if you're not on any medications, you'll be on it because you see blockage. That's the only way you can stabilize the plaque. Once you have a plaque buildup in your heart arteries or any arteries, it is extremely unlikely that it will ever go down, no matter what you do. But you can stabilize it.
That's very interesting.
Okay, you can stabilize it to see that hopefully it never causes a problem to you, and that happens by taking medications, certain medications.
Well, different body types, right?
Yes.
Either you're born that way
Yeah.
or you achieve that plaque.
Yeah.
How do we avoid it?
So, genetic plays a huge role, just like it plays roles in everything, right? My skin color, your skin color is different, right? We share probably 99.99999% same DNA, right? But the slight genetic changes everything, right? How tall are you? How short are you? Right? And same thing goes to the heart arteries.
Mm-hmm.
Some people are genetically predisposed to have blockages. Some people are not. You see people who smoked all their life like a chimney and they have no problem.
Wow.
Why? They got pretty strong genes.
What about alcohol?
Oh, yeah. Alcohol is the recommendation from American Heart Association, okay, would be 0 alcohol. No alcohol is a good thing,
Yeah.
basically, because any terms of alcohol is toxic to your heart.
Right.
Okay, especially if you have a heart disease, especially if you have an irregular heart rhythm, such as atrial fibrillation, which is pretty prevalent. Yeah, but you got to enjoy life. I'm not saying you should not have drinks. I think you have to have it in moderation.
Right.
Right.
Everything.
Yeah. I mean, if you drink a lot, alcoholic cardiomyopathy, right? Meaning your heart gets weaker because of too much drinking alcohol.
As we get older, what is your advice to over 70s to watch out for your body? What do you suggest?
From a heart perspective,
You're right.
I think staying active, very important things, right? Being active. And activity doesn't have to be running on treadmill, pumping irons in the gym, or working out heavy. Activity could be minimal, even just walking every day.
Yeah.
Just walking every day, 15, 20 minutes, walking in the morning, walking in the evening. Daily routine, that's active, okay? If you have medical risk factors, problems, prior existing problems, history, family history of stuff, I think seeing your doctors regularly is not unreasonable.
Absolutely.
At least once a year. Physical exam, right? Once a year physical exam to make sure everything is okay. Your cholesterol is okay. That's how you prevent everything, right?
Right.
keeping your mind active. Right? Especially a lot of patients I have, once they retire, you got to pick up a hobby to do something that keeps you active. Something, you need purpose.
What about people? Interfacing with people.
That's very important. We're a social animal. Yes. Human beings are extremely social animal.
Right.
We're not meant to live, by ourselves. No matter how much we say that, but social animal. Having one or two good friends or family, I think interacting with people is very important. Laughing is great for your health.
Very important.
Very important, right? Just these are very basic stuff, like a very basic stuff that we sometimes neglect. Talking to people,
What have you learned from your brother?
A lot. Yeah, my brother. I mean, he's
How many years are
we are 6 years apart.
6 years.
Yeah. So he has, there's a lot of things that he has done that I've followed his footsteps. There's a lot of things I'm sure now they're both adults, that he has learned from me. I learn a lot from my colleagues and my partners. Right? You got to keep an open mind. When you're young, you have a little bit of ego, but you got to put ego aside. When in training, that a lot of the doctors would always say, medicine will make you humble.
I imagine.
Because no matter how good you are, no matter where you are, something can always happen. So you always got to listen to other people who have had more experience than you, and it's vice versa. Like my partner, Dr. Korsandi, and my brother, both of them, they are obviously senior in the practice, but we always talk about cases together. We always discuss things together, right? Because we can always learn from each other. There's things I know that they don't know. There's things I don't know that they know.
Well, you told me that with the last time, because your brother handles my wife and you handle me, but you said that you're the one that talks the most.
Yeah, we all talk a lot. I do talk a lot.
No, I love that. How do you balance it with your patients?
That's why you have met all our wonderful physician assistants,
yes,
right?
They are
Lindsay,
fantastic.
Kelly, Ariel,
right? They're fantastic.
Megan, all of these people.
And I see them in the hospital.
There you go. They're the one who kind of drags us out, right? Then when I'm outside, our medical assistant, they'll say like, because what happens? How many times when I'm sitting with you, we're talking about golf or something different, right? Because a lot of time, when I walk into the room, 90% of the time I know exactly what the plan is, right? And then patients, when you talk to them about, most of my patients, like I know them very well.
Yes,
like I know their family, I know their kids, I know this, what they do, because we already have a plan that's already been determined for them, what we're going to do. Absolutely. And the rest of it, we're just hanging out. They know everything about me, my kids, my family, where did I go, what we did, stuff like that. And I think that's what creates a good doctor-patient relationship, right? Trust.
Right.
Everything works on trust.
Absolutely.
I tell the patient all the time, even you have slightest doubt that I'm not sure whether I should do this, you should ask for a second opinion. Because, meaning everything we do, it belongs on trust.
Right,
if you don't,
it does.
Because, and for me, I'm honored because the patients, when I tell you, hey, I need to do this procedures, and you're like, all right, let's go. You laying down on table.
Yeah, absolutely.
Knowing that something bad can happen, that includes dying in a heart procedures, right? And that much faith you have in us, and I think we're obligated to give it back.
Well, the thing that impressed me most is because I had a local, I could hear you talking to your colleagues during the procedure, and I felt fine. I was in good hands.
Yeah, I mean, we have wonderful nurses and techs that we do cases together, right? So when we do a lot of things, we always bounce ideas about stuff, and that makes the whole team.
It's a great team. It's a great team.
Yeah, you got to have it as a team. You have to be open-minded to listen to everybody else's opinion.
Doctor, because we're going to have to close this conversation, but I would like to ask you, what inspires you? The name of this program is Inspired.
The life is all about, like my partner always says, every moment of the life, you just got to enjoy. And inspiring is helping. What I do, at least I'm privileged to be in a field, right? Every day I wake up and I make some change, small changes, big changes.
Save
in
lives.
People's life, yeah. Quality of life. They're obviously prolonging their life. And we are all privileged, all doctors. And every doctor, I think, I would say close to 100%, they all have the best intention for their patients.
Yeah.
Best intention. And I think this is why we are what we are. Doctor it's a life. It's your lifestyle. I'm never off the clock.
Right.
Yeah, right. 9 o'clock, you're still.
So how do you
Lala.
maintain your level of interest, attitude? What do you do anything for amusement?
Oh yeah. I mean my.
Do you play golf?
Oh yeah, exactly. I mean, in fact, I'm playing tomorrow. I mean, that's something I picked up a couple of years ago, and I enjoy it a lot. I mean, there's a lot of sports I play. My kids, I have a son, Noah. He's 8 years old. My daughter, Eliza, she's 4. My wife, Shahina, we do a lot of trips, weekend stuff, family stuff. There's always something to look forward to, and you just keep going. This is life, right? As long as you enjoy the family life and the work life. And I'm privileged to be that every day when I wake up, I'm happy to go to work, and that's what keeps us going. And then I meet people like you, wonderful patients, different. Everybody's with different life. It fascinates me sometimes, like other people do, because all my life, all I've done is medicine. Right. So when I see some people do all these interesting, wonderful stuff, like I can't even wrap my hand around. I'm like, wow, really? This is what you do? This AI thing and this thing, and this is how things are, and that's what I think. Every day I'm talking to different patients and different life and different things, and it's always something new. Always something new. I think that's what keeps us going.
That's right. That's
it.
right. That's very good advice.
Yeah.
But I can remember my daughter calling me up because you met her, and she said, did the doctor say anything about nutrition? He said, enjoy your food in moderation. I'm not going to tell you to cut back or whatever, but at the same time, moderation.
Moderation. Food, good quality food.
Right.
Buy good quality meat.
Right.
If it's wrapped in plastic, I'm like, I stay away from it. Go to the butcher shop. Like, there's so many good, clean meats that they can cut you right and give it to you, right?
Right.
Like, those are the type of food you're supposed to be eating, okay? Unfortunately, the processed food is what has destroyed American livelihood. Industry. Everything's controlled by industry, so that's where we are. So in those time, you look for good stuff, right? Active, good quality food, and you don't have to restrict everything. You gotta enjoy life.
Right.
Okay, but everything has to be the most important. As long as your weight is balanced, you're gonna be all right. You're gonna be fine. I'm not worried about you.
Well, I thank you so much for taking this time. I know you're a busy guy, but thank you so much for your helpful hints, and keep up the good work.
Thank you so much for having me.
We depend on you.
Yeah, no, thank you so much for having here. I think it means a lot. I think it's good to talk about these things, okay? And I hope we keep making changes in people's life.
You've made changes in my life already, and I appreciate that.
Well,
and my wife's life, too.
I hope she's doing well. Is she here?
No. Thank you.
Thank you.